Do you know what the 5 most common diseases are in our senior cats? Better yet, do you know what the one clinical sign is that they all share? If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. If you've spent any amount of time on this channel, I'm sure you have figured out by now that one of the most common clinical diseases in our senior cats is chronic kidney disease. There is video after video on this channel about that topic. So I'm not going to go into it in great depth because you can absolutely binge all of the other videos that I have created, but probably one of the top clinical diseases of our senior cats is chronic kidney disease. It's almost as if the kidneys are the weak link in these guys. We half-heartedly joke that the kidneys are the weak link in cats, the gut is the weak link in horses. It seems like every mammal has kind of this weak link where if they live long enough, this is the organ that's most likely to give out first. So in cats, it tends to be the kidneys. We see a lot of chronic kidney disease. And people always want to pinpoint this one thing as the exact cause of chronic kidney disease. And the fact remains, we just aren't there yet. But it is definitely on the list of top diseases in our senior cats. Another disease that is incredibly common in our senior cats is hyperthyroidism. So basically, this is a disease where the thyroid gland produces too much hormone, and that excess hormone usually results in a cat that has a spectacular appetite, but is just wasting away. They're just thin and bony, they don't have a great muscle mass. And it can present with the same clinical sign as chronic kidney disease. With both of these diseases, we do also have to be careful of high blood pressure. The third common disease in our senior cats is, and these are in no particular order, like I said, chronic kidney disease is very common, but these are in no particular order. Honestly, not only is it likely that your cat is going to develop at least one of these diseases at some point in their senior life, cats are notorious for collecting diseases. So it is absolutely possible that they will not only develop one, they will develop many. So chronic kidney disease, hyperthyroidism. Another one that we see commonly is diabetes. And diabetes in cats can take two different forms. We can have the form where the body isn't able to produce insulin. So this is one where the cat has to have insulin injections to function normally from day to day. Cats can also have something called insulin resistance, where their body is still producing insulin, but it's not responding to it. And these cats, some of them do tend to do well on insulin injections, but we do have newer therapies available too, where you may not have to give insulin injections to keep these guys feeling good, acting good, healthy. So that is chronic kidney disease, hyperthyroidism, diabetes mellitus is the most common version. And then the next disease I would actually lump into a category, and I call it the GI diseases. And these are things like inflammatory bowel disease, pancreatitis, the category of diseases that's usually some sort of inflammation stemming in the GI tract or around the GI tract. Oftentimes it's causing poor absorption, sometimes it's just causing gassiness, crampiness, and just poor chewing. This is the category that cats are probably the best at hiding until we're pretty advanced in the disease process. Although if you operate under the theory that no vomiting is normal vomiting, because that's a common misconception with cats. I hear and see it all too often that, oh, I just have a vomiter or my cat's vomiting again. We kind of brush it off because it can be relatively common. But if you operate from the perspective of vomiting is not normal in cats, oftentimes we'll catch these GI diseases a lot earlier in the disease process when they have a better prognosis. So it is important to note that even though vomiting is a clinical sign or a symptom, it's not something we consider normal in cats from a medical perspective. So if you keep that in mind, oftentimes we can catch these GI diseases sooner. If you operate of the theory that some cats just vomit, then there is a chance we may find these diseases later in the process. And then the fifth common disease that I am going to discuss as far as our senior cats go is cancer. And this is almost to be expected because for the majority of cancers, it's a disease of age, meaning the more our cells reproduce, the longer time they have to reproduce, the more chances there are for something to go wrong. So it makes 100% sense that we have cats that are living so much longer than they used to. In fact, I just cringe when I have clients come in and they're like, oh, he's 12 years old, he's so old. I'm like, oh my gosh, please don't tell my 15 and 16-year-old cat that, because I just don't consider 12 old anymore. With the advances in medicine that we have, our cats are commonly living into their late teens and early 20s. So the longer we have our cats and the longer these cells are doing their normal day-to-day thing and they're reproducing, the greater chance there is that something's going to go wrong. It's absolutely true that a lot of our cancers are a cancer of time and age. It's at some point bound to happen. Now, does that mean all of these cancers are horrible? No, we definitely have some slower moving, less aggressive ones. And then, of course, we've got the more aggressive ones. But it makes complete sense that the bigger population we have of senior cats, the more common it is going to become to see some of these cancers. Now, kind of the real mind bender with all 5 of these. So again, chronic kidney disease, hyperthyroidism, diabetes, GI diseases, and cancer is that a clinical sign associated with every one of them is an increase in water consumption. Does it always happen? No, but it is something that if I had to tell you to watch one thing about your cat's health and keep really close track of it, I would tell you to watch how much water they're drinking. And usually the flip side to that is how much urine is in the litter box. Because, let's be honest, we probably pay attention more to the litter box than we do to how much water our cats are drinking, because oftentimes we're not home all the time to watch our cats drink. Or you've got that cat that you don't ever see it drink. And those are probably the easiest cats that if you never in your cat's life have seen them drink and suddenly you're actually seeing them at the water bowl or the water fountain, that is definitely a change worth noting. So whether or not it's that cat that you've never seen drink that is now at the water bowl and you're seeing it drink, that's a change worth noting and looking into, do we have any of these diseases going on? Or is it a cat that you have seen it drink, but now they're just hanging out at the water bowl? They are always there. Or are we seeing more clumps in the litter box? Are we seeing bigger clumps in the litter box? Are you going through more litter? This is probably one of the biggest clinical signs or symptoms that something is going wrong. You need to be in touch with your veterinarian when this is happening. And it doesn't always mean we have one of these 5 diseases. It can be as simple as a urinary tract infection, but it is absolutely a symptom worth noting. If you are seeing it, you need to be in contact with your veterinarian, because the other component to this is you cannot diagnose these diseases at home. Many of them we can find on routine screening lab work, so it doesn't have to be this big invasive workup. Some of them we do need to do a bigger workup. Some of these cats need an ultrasound to give us a better idea. Sometimes we have to go all in on biopsies or exploratory surgery, but the fact remains that there is no way to look at your cat at home and know which of these diseases is going on. We have to get some sort of diagnostics involved. And as with so many things, the sooner we can do these diagnostics and the sooner we can find the problem, generally speaking, the better the prognosis. Because as I have said before, cats are masters of disguise, and a lot of times by the time we realize there's something wrong, we're already behind that 8 ball. So if you are noticing, that water consumption change or the clumps in the litter box change, alert your veterinarian. Keep in mind these 5 diseases. Is this a comprehensive list? No, of course not. There's many diseases out there, but these are definitely probably the top 5 diseases that are common to our senior cats, and it's a great place to start when looking for answers when we notice changes. And if unfortunately your cat is diagnosed with chronic kidney disease, come on back to this channel. I've got tons of resources here for you. There's, all of the videos in the library that are already created. There's also my free resource, the 5 most common mistakes made when caring for kidney disease cats. That can be a beneficial resource for you. And then I continue to add to the library as topics are brought to my attention and questions come up. I will also mention 2 other common clinical signs that should raise red flags, and that is either your cat is losing unexplained weight in the face of a good appetite, or your cat's appetite drops. Those 3 clinical signs or symptoms, change in water consumption, change in eating habits, and weight loss, are probably your gold standards for deciding whether or not your cat has something going on that should lead you to contact your veterinarian.